So today there is no work, but I just want to talk to you about eye floaters. I want to make some clarifications about what eye floaters actually are. I see like most people think eye floaters are diseases on their own. So like when you ask somebody like what eye disease do you have, they usually say like I'm suffering from eye floaters. That is my disease. When you ask another person, he will also tell you that I also have eye floaters. That is the only eye disease that I have, thinking that eye floaters are diseases on their own. But actually, eye floaters, they are not diseases on their own, but they are rather some symptoms of other eye diseases. They can also be showing that something is wrong or might be wrong at the back of your eyes. That is what they're actually showing. And that's why sometimes some patients or some people experience these eye floaters after surgery. So that is showing that something is wrong at the back of their eyes after the surgery. So they are not diseases on their own. Also, many people believe that there is a cure, or like I can say, there is medication for eye floaters. I've seen it many times online. People are even selling it and they are telling you that this is a cure for eye floaters. This is a cure for eye floaters. This is not true. This is not true. To be honest, I'll tell you, currently there is no known medication that can treat eye floaters. Whether it is an eye drop or whether it is a tablet medication or a pill that you can take in so that it can cure the floaters. Otherwise, you are just wasting your money. There is no known medication for eye floaters. So don't get deceived by any kind of medications. Yeah, another misconception about eye floaters is that after people undergo surgery for eye floaters or for the condition that causes the eye floaters, they usually think that after the surgery I will immediately stop seeing that floaters. But that is not what actually happened. In fact, usually the opposite happened. People say they report seeing more floaters even after the surgery. I had a patient who is in Saudi Arabia. He saw my videos on TikTok that I talked about. I think the video wasn't talking even about floaters, was talking about glaucoma. I was raising awareness about how you can know if you have glaucoma. So he saw that video and he messaged me on TikTok, he DM'd me, and and he was complaining to me that he had undergone an eye surgery for floaters, as he said, and instead of him to stop seeing the floaters, he is seeing them even more open. They are now worse, and it is so annoying. So what exactly is happening? Why this? And he was even complaining that he has spent a lot of money, and after spending that lots of money, he is still seeing these floaters. And the eye doctor told him that he has to return back to the hospital after like 2 months so that they could review the eye. So it's not yet time for him to go back to the hospital. But the floaters, like, they are disturbing him. They are becoming even more annoying. So I told him that what they don't told you is that it's not immediately after the surgery you will stop seeing the floaters. It doesn't work like that. Most times, as he said, after the surgery, you might see even more floaters or appearing from different directions than you usually see. That is because it depends on the kind of surgery you have undergone. There are different eye surgery based on the cause of the floaters. Nevertheless, whatever kind of eye surgery you have undergone, mostly it involves either removing that gel material that is at the back of your eyes that is clamping together to cause the floaters, either removing it completely from your eyes or like degrading it using a light that we call a laser. That is, the process is called laser surgery. So where a light will go into your eyes and degrade down that clump of that gel. So what will happen usually is after that light break down or degrade down that clump of gels that is causing the floaters, some of them are not absorbed into your eyes until like after 2 months. So that's why if they are break down into like smaller particles at the back of your eyes, that small particles will also, you will also still be seeing them as floaters, because as I told you, floaters, they are like something blocking you from seeing they are that gel material that are blocking light from reaching the back of your eye. So that small things, no matter how small they are, they might also start blocking the light from reaching your eyes, and you'll be seeing them as floaters. So they are usually getting absorbed naturally after the surgery, like after for like 1 to 2 months. And that's why you have to just be patient with the situations. If you have undergone surgery, you have to be patient for like after 2 months. If they are still getting worse, so you can return back to the doctor and tell him what exactly is happening so that he can find a solution for the case. I hope that helps. Thank you. Don't forget to subscribe to this channel if this is your first time coming. I am Dr. Arun. I'll see you in my next video.